Okay, go, Joe.
I welcome you for our second webinar for this year entitled The Role of Data Analytics in Organizations. Today's webinar is being organized by the Gozo Business Chamber and Europe Direct Gozo in collaboration with Bank of Valletta. Data analytics is a process to examine data gathered and to find present trends and thereafter draw conclusions about the information found in that data. Diverse techniques are used to collect data analysis, which enable all sorts of organizations to make better informed decisions regarding their businesses. Obviously, correct and timely decisions result in more revenue, improved operational efficiency, more effective marketing campaigns, and better customer service. In today's ever-increasing competitive world, businesses must be proactive to new and emerging market trends rather than reactive. Data analytics is one of today's main tools to reach this goal. Indeed, the aim of this webinar is to increase the awareness about the use of data analytics in our businesses and potential careers in this sector. We have today two very important speakers. To this end, special thanks goes to John Paul Kauki from the Queen Mary University of London and Lara Selvaggi, Head Data Insights and Economics at Bank of Valletta. I would like to thank them in advance for their contribution. All of those who are participating on our online platform, please feel free to post your comments and questions, which will be answered by our speakers during the dedicated question and answer session. To this end, we hope that you will find this webinar useful. I now kindly invite Joseph Borch, President of the Gozo Business Chamber, to deliver his introductory remarks. Joseph.
Thank you, Jesmond. Good morning to all those who are participating in this webinar, and in particular to Lara and John Paul, who will be delivering their own presentations later on. If we go back to 4 years, basically, 2019, we had conducted an insular forum here in Gozo. During that forum, we had tackled specifically the subject of digitalization as a tool for islands. Little did we know that a few months later, we would be facing a significant crisis, the COVID-19 pandemic, during which digitalization would play an important part. It was the only thing that kept us together during the difficulties that we faced during the pandemic. While in that forum, we were arguing that digitalization was an important tool for islands to bridge the gap, when it came to the difficulties emanating from their geography. Its importance was noticed by all when the COVID-19 pandemic put a halt to all mobility between places and countries. Nonetheless, the difficulties related to accessibility for islands such as Gozo and even Malta itself still remain. During that forum 4 years ago, we had highlighted the importance of the European Commission's adopting a digital roadmap for islands. To this end, as a chamber, we still believe in the importance that our businesses and organizations make the most out of digitalization. This webinar falls exactly within that area of assistance, highlighting the importance of an area of digitalization, which is perhaps less known, but even more recent. The extremely important data analytics. The benefits of data analytics for organizations, for businesses, are obvious for all to see. Data analytics is a critical tool for businesses, for organizations that want to stay competitive in today's data-driven business landscape. It can help organizations make better decisions, identify new opportunities, optimize their operations, measure their performance, and provide personalized experiences to their customers, amongst many other things. But we'll be hearing from Lara and John Paul about this. We are also happy on our part to be organizing this webinar in collaboration with our Europe Direct Office, which has for the past 3 years on an annual basis been organizing this event. The objective is to raise awareness among students about potential areas of digitalization, and today, especially on data analytics, in which they can see a future, in which they can specialize. I wish you all a fruitful seminar, and thank you.
Thank you, Joseph. Now I kindly invite John Paul Kauki to deliver his presentation. John Paul.
So, hi, good morning. Thank you all for attending this webinar. And without much ado, let me start with my presentation. So I'm going to share the screen. So my presentation is about digital health surveillance. And I'm going to talk partly about both my experience in doing this, and also we'll be talking about the potential that it offers. So we'll get started. So I'll just move this to the side. So first of all, my educational journey. I started with medicine. Actually, I'm a qualified doctor. I studied at the University of Malta. I then specialized at the London School of Hygiene, Tropical Medicine and Environmental Public Health. Subsequently worked at the University of Malta on an EU project where I looked at environmental and lifestyle risk factors for breast cancer. And then I subsequently carried out a PhD in Brisbane, Australia, where I carried out some research in the Pacific. And this research, these images are from Kiribati. It's an island nation in the Pacific. And basically, as I said, I was looking at the focus of climate change, food security, and health interactions. And to do so, I applied the mixed methods, where I had to use both quantitative data and qualitative data. This experience taught me the importance of accurate data collection, the struggles of collecting data in places where perhaps it's more difficult than others to do so, to collect data because of geographical constraints or information technology constraints, etc. And that also importantly taught me on the importance of ascertaining meaning from numbers and words. We have words thrown at us all the time, but what do they actually mean? What about their context? And how can we apply that information in a way that makes it appealing to us to understand, that can inform policy decision-making? Data was also often missing, making it very hard for me to come to conclusions. This is a real problem. So for example, I tried to get data for time series analysis. So basically you get data on temperature and health outcomes, for example, and you measure it over time and see if there's a correlation. There was one island where they had the temperature meter, but basically data from January 1991 to September 2010 was missing. This meant that at the time when climate change was started being measured in a very crucial way, the data was missing. So I couldn't really work on that. Secondly, for example, I struggled to find good data on non-communicable diseases such as diabetes and so on in Kiribati because the latest data was from 2008, which goes to show how, it's very dated information, but it's the latest that I had. So of course, it was quite embarrassing talking about these statistics when there was probably a huge change within 10 years, So this is why data is key, but also why data analysis is key. Data analysis is a process of inspecting, cleaning, transforming, and modeling data with the goal of discovering useful information, informing conclusions, and supporting decision-making. I'm now going to go into the Malta scenario. So imagine you have a data set like this. Okay, this is an excerpt from the data set that I have from Kiribati. It's overwhelming, but this is the raw data. And the challenge you have is how to transform this data into something useful. So in public health data surveillance, we start with planning the data. What are we going to do with it? What do we want? How shall we collect it? You then go into the actual data collection where you have to ask questions on data sourcing and data collection methods. Okay, data analysis and their interpretation comes next. And this is very important because here you need to do data cleaning. And trust me, it sounds like an easy task. It is not. And I'll give you some quite amusing examples from the Malta story we're going to go into soon. And then you evaluate the data. You present it in a report or in a visualizing way, visually compelling way, and then you disseminate that information through which then decision-making can occur. So Right now, I'm still working part-time with the Public Health IDCU department, the Infectious Diseases Control Unit department. In 2020, at the start of the COVID pandemic, the ECDC, the European Center for Disease Control, basically complained that data from Johns Hopkins University in the US had better data on COVID-19 in Europe than the ECDC itself. Okay, just to put things into perspective. And this led to a coordinated effort to be started among many countries in the EU and non-EU as well. And the eSARI network was born. So basically here, we are involving 15 countries that pool their data on, I'm going to say, it's called SARI. It is severe acute respiratory illness. COVID falls under that, which can be used for both decisions in policymaking and in ascertaining vaccine effectiveness in Europe. So these are some of the things we started working on. Problems identified. There were poor data collection methodologies. There was a lack of standardization. Definitions varied from country to country. You had archaic methods of data collection. I'm going to talk a bit about the Malta situation. There was a lack of coordination, and there was poor stakeholder engagement. So, Malta's problems. Malta had only literally just shifted from a paper-based system of reporting health data to a digital one, El Famous file, okay, which are often lost. You lose data on your patients, they're clunky, they're on shelves, you can't find them, okay? So the story used to be the patient enters admission at hospital, the history is taken, and it's written on physical paper files. And I can assure you that many of these used to be lost, which is not only a big problem in terms of data protection, but also in terms of how do you manage your patient. Advantages were it was a standard format. Disadvantages meant that it was difficult to access. You had to physically go and read the file, cumbersome and error-prone. Okay, so it was impossible to carry out data surveillance, basically. You could try, but it was going to take you so much time, it didn't make it worth it. Okay, one of the key components of surveillance is that you have your tab on the key currently. If you're looking at data of 6 months ago, it's not surveillance, it's history taking and analysis, okay, like research. So there was a new system set up. It was a step in the right direction, but far from ideal. So the new system was basically computer-based. So patient enters admission, history was taken, and then electronic paper files were generated. Okay, so this meant that you could technically access these from any computer, which is already made. So we went over the accessibility barrier. But then you still have problems I'm going to talk about. COVID-19 accelerated this. So COVID-19 was a big push into going digital. Data is now entered onto a system as text. So it effectively is an electronic paper. It is still insufficient. Why? Because while it makes it more easily accessible, there's no means of extracting the data other than manual extraction. So we had to start a surveillance system reading every file of patients that we think would fall under SARI. Okay. So basically, imagine you have a file like that, okay, and you have to read through it and fill an Excel sheet as shown below. This was a very cumbersome process, typos galore. Doctors have different ways of writing things. There's no standard format. This is time consuming and prone to human error, both at data entry and data extraction level. There's missing data. Doctors might not put in the person's temperature, for example, which is a huge problem. So over time, we also identified other sources of data. So you have COVID-19 testing, respiratory panels, COVID-19 vaccinations database, mortality data, hospital census, influenza vaccination. And we'd link these using ID codes. Okay. However, I can assure you these were error-riddled. So we used to find, for example, I remember there was a case of someone who was entered as having 56 vaccinations. Clearly an error. What happened was that the server glitched and repeated it 56 times. Okay, but how do you clean that? You would have people who were registered as being dead and then taking a vaccine afterwards. Okay, why was that? Because they didn't distinguish between an appointment and an actual vaccination taken. We highlighted these errors, they were fixed later on, but I'm giving you examples of how data collection and standardization is key to this. Tools required. So we use the software called R. It is free. It is basically a very gold standard software for statistical computing. So imagine you get an ID, you find it in every database, you write the code, Control Enter, boom, everything is just collected into one data sheet, which we then can proceed to analyze. It is efficient, it is constantly upgradable, and allows heavy statistical analysis. It is magnitudes of speed better than using color-coded Excel sheets for work processing. I want to give you an example. The department, with all its limitations, but one has to organize that there's very little training available in Malta on this stuff, okay? Before, the way it used to work is you get people who sit down, get 3 different Excel sheets, read an ID number, search for it on another Excel sheet, get the data and plug it in there. Then you need to go to the next. This used to take weeks, but now you create a code. It takes you an hour of coding, you check it out, you press Control Enter, instant work. So it's a magnitude of efficiency improvement, okay? Other software which are being explored currently at the IDCU are Microsoft Azure Text Analytics. So AI is just exploding right now, as you've probably read. So basically, this would mean that a patient's records are basically scanned. It automatically extracts data based on the context. So for example, if there's denies cough, it would go out as no cough. So cough, it would be no, for example. There's Power BI, a very powerful tool. There's SQL, which is great for searching and analysis of large database. So these software packages are being explored for their potential to extract data automatically. We want to automate the process. It would probably make it as accurate, and it avoids the human error element and helps us humans move away from repetitive chores and focus on better things. Such as visualizing data in a compelling way. Malta is currently moving to the system called Patient Dashboard. Okay, this has already been taken up by some wards. So basically here, it goes from writing text into actually just filling forms. Okay, so this means that at the back end, there will be an Excel sheet and we'll just extract data from the Excel sheet. So rather than having to manually read records, we'll just say, okay, well, I want all patients who have fever, cough, shortness of breath, and the symptoms started more than 10 days ago. Boom, gives you a list. You can start working with that immediately. This could also be expanded to other illnesses, allowing real-time surveillance, and cases can be extracted based on symptom presentation. Now, why is this important? It can be integrated with other systems such as environmental data, zoonotic data, and allows for public health research to be carried out. This was a paper that I published with some fellow authors. We looked at the effectiveness, basically, of vaccination regimens in basically protecting you from Omicron infection. It was the first study of its kind, I believe, done in Malta. We had 255,000 records to use, and it gave a very robust answer showing the effectiveness of vaccination. So this, I invite you to go through it if it interests you. So why am I saying this? This can improve Malta's public health capacity, audit its abilities, and improve on what we already know. And frankly, it helps us be prepared for the next pandemic, which is inevitable. So I'm going to give you an imaginary scenario. Pollux 2025, I'm inventing this virus. If it were with the old system, data is present in manual files, it is virtually impossible to assert a symptom combination. So imagine the WHO would say, okay, we need to have a tabs on all people entering with cough, shortness of breath, high fever, and symptom presentation within 6 days, and also diarrhea and nausea, for example. We have no idea how to do this in the old system because you have to manually read the files. You have to, so this means that there's no surveillance. One has to wait for test kits to arrive from abroad. This has considerable impact on the economy and mounting anxiety, okay, because nobody knows who's infected and who isn't. There's a mortality increase, okay, because one is unable to trace the presence of this combination, and draconian actions are taken. Okay, so everyone has to stay inside, for example. The clinicians are anxious because they are exposed to disease and they don't really know the prevalence of this disease within the hospital. With the new system, data is present in digital files. Symptom combination is immediately identified, determining presence of disease of people entering hospital. Measures taken to immediately quarantine those with symptom combination matching those of Pollux. Ability to trace symptom combination in clinics across Malta and Gozo. Why? Because we integrate it with primary healthcare systems. The prevalence of disease is kept under control, and clinicians feel reassured knowing who is likely to be an infected patient. So look at the huge change over there, and improved healthcare, lowering mortality rates, etc. So in summary, Now is an exciting time to enter data visualization and data analysis. AI tools such as ChatGPT are immensely powerful and can save a lot of time on searching and finding codec syntax. Give an example, it used to take me hours to come up with the correct syntax to carry out something. This time I just go on ChatGPT, ask it to write code for me. Sometimes it has a few errors, but eventually it gets there. Time saved, endless hours, and frustration, to be honest. Malta's requirements in the sector are increasing, especially because there is little to no such capacity in the health sector at this time. So it is an exciting time to consider this sector. And now I'm going to give you some examples of visualizing data. And the idea is not to just show you eye candy, but just to show you how compelling it is to move from just showing tables, and numbers to something really that the human brain understands. We're wired to understand patterns, and with health, that's great. Okay, so these are from a website called the IHME. I highly encourage you to look through it. So here, for example, we're looking at basically all-cause DALYs, disability adjusted life years. It's a measure of examining the burden of disease, okay, for all ages and all sexes, both sexes. And over here, you can see that there is, in fact, non-communicable diseases are shown in blue, infectious diseases are shown in red, and avoidable injuries are shown in green. And this gives you a picture globally of where the biggest problems are and where the changes are happening. Why? Because you're putting in colors, you're putting in boxes, and you're putting it in a structured way. So this is an interesting way of immediately getting a picture as opposed to endless numbers and charts. Here, for example, it shows you which how diseases have changed over time. So in 1990, infectious diseases globally were the top concern, but now non-communicable diseases are. You can see there's cardiovascular disease, neoplasms, which are cancers, etc., etc. So this shows you the change that has happened over 30 years in public health globally. Okay. You've got, for example, comparing DALYs per 100,000 people over here as a standard. You've got, for example, in different countries in 2019 for males and females. So this is just ways of visualizing data. I want to also note, when you hover over these on the website, they're interactive. It gives you more information. Okay, I can't do this because my plugin for PowerPoint doesn't let me do that right now. Okay. Other ways of visualizing data. The left, I call them, they're called violin plots, which give you an idea on the distribution. Here it's a distribution of bill length across penguin species, just a very random thing, but this gives you an idea of what violin plots are. And to the right, on the top, that's an example of a visualization. You've got the day of the month on the x-axis, you've got hours commencing on the left, on the y-axis, and each cell shows basically an hour of a day. And that shows you temperature. So I applied that to a specific island that I was asked to research in Australia, and the Torres Strait Islands. And anything shown I invite you to look to the bottom right, and anything showing yellow and above is dangerous to human health. Yellow is extreme danger. And there it shows the hours of the day and the month of the year, which are dangerous to human health in that particular location. You can see over there immediately, you get an idea of what's going on, okay, as opposed to writing tables, which are very unimpressive. Another example, then you can superimpose data. So, for example, to the left, there's temperature curves together with, for example, sales of oral hydration solutions in Tokyo. It gives you an idea of what can be done. Okay, why? Because when you superimpose data, it gives you a better picture, as long as it's not too confusing. Okay, to the right are what I call temperature-related mortality series. This is fascinating from multiple perspectives. So basically, there we're looking at the adaptation of cities to temperatures. So on the left is the relative risk of dying, okay, mortality risk. On the x-axis, there's temperatures, okay, and then over there you have those time series analysis curves. And that shows you, for example, that in London, if you go to cold temperatures, the risk of dying increases exponentially. Same with heat. But for example, in Stockholm, there's almost no association with cold. Why? Because their houses are much better adapted to, and people are more acclimatized to cold temperatures than in London. Same thing with Rome and Madrid. So this gives you pictures. I've done this for Malta as well, by the way, and we found the pattern. Surprisingly, cold tends to be a bigger killer for now, but as climate change accelerates and we shift to the right side of the spectrum, we're going to get many more heat deaths, unfortunately. This is a very preliminary data. Okay, but I just want to show you this is air pollution data, one taken at Sanglia, the other at Msida. And that shows you nitrogen dioxide pollution levels. So to put you in the picture, I applied a heat map basically here. You can see that basically there's the day of the month, and you've got the month and the year. Okay, and it goes to show over here, anything orange and above is dangerous to human health. So you can see how dangerous that air pollution is that we're breathing in those localities. And it immediately is much better than just showing, you know, a table, which is the one to the right. Fine, if you tell someone at 52% of times it exceeded limit, fine. But when you show this, it gives you the feeling, you know, that, oh my God, we're actually breathing this air. So look at how visualizing the data is so compelling. Another thing I want you to look at is to understand the potential over here. So, for example, bottom left, we've got vaccination rollout. Okay, you've got COVID deaths, and you've got deaths among nursing home residents. So it shows that in nursing homes, if they're giving the vaccines, deaths just plummeted once vaccination rolled out. Okay, as opposed to the general population. So when you compare these things in a visual, compelling way, it shows you how effective health decision making is, how effective some policy making is. To the right, you've got, for example, vaccinations in the UK, gives you an idea of the proportion of people who took the number of doses over time. Now, why am I showing the London boroughs over here? You've got that shifting GIF over there, and to the left, you've got a real nice map over there. Why am I showing these? Because London is an amazing case study of how they apply geographical data on a postcode level. So, for example, in London, a postcode would be that the resolution is down to 6 doors. Okay, so if I do WC12A3, okay, that means that it's a door and the next 3 doors to the left and to the right. Okay, so imagine getting health data to that resolution. You can do amazing things with public health. Okay, in Malta, to my knowledge, we don't even have geotagged postcodes available to the public domain. I've requested them numerous times. I never get a reply. So imagine the public health potential we're losing over here. You know, we can really narrow things down and get a lot of information which is useful for us all. So in conclusion, data analysis is key to effective policy decision making. We cannot just take policies on the cuff. We need science to inform us, and surveillance through data analysis, through the health data analysis, gives us that tool. Malta needs to invest in its capacity to carry out effective health surveillance. We can't stay with color-coded Excel sheets, please. I'm talking about the reality we're in today. And I'm constantly pushing for people on top to recognize that we can't keep with the same old. Okay, we've always done it this way. They tell you that, they literally tell you that. And I tell them, well, things are changing now. We have way more data. Why we want to stick with, you know, color-coded Excel sheets and, you know, reading things sequentially when we can get data output in a moment's notice. You know, the centralization of data makes it easier to carry out effective health data analysis. Okay, we can then integrate it with other data sources such as geographical data, environmental data, economic, sociological. You know, it's endless. You know, we just need to make sure that it's integrated properly. And the result, the ultimate result, is not just to make it fancy, but to have better community healthcare, better health outcomes, and it is cost saving. You know, if you're employing someone to stay matching Excel sheets for months, as opposed to just writing the code and pressing Control Enter and having it done in 5-minute stops, you know, this is a great cost saving. So that's it. Thank you very much, and I'll be happy to take any questions if you have time for it.
Thanks, John Paul. Thank you very much for your overview of the subject in the area of public health. Thank you. So the scope of our webinar is also to provide new insights about the various areas of the digital sphere. And your insights of the crucial role of analytics in the area of public health has been very enriching. Thanks a lot. I would now like to invite Lara Selvaggi to deliver her presentation. Lara.
Thank you for your intro. So give me a moment whilst I share my screen. So today, what I'd like to walk you through are some use cases, in particular, when it comes to BOV. So BOV have invested in an economics and a data insights unit, which is a unit that I lead. And there's a lot of low-hanging fruit when it comes to data insights and the enablement that one can bring to an organization such as Bank of Valletta. And I'd like to start with the simplicity of an organization, how easily one can move from one stage to the other. So for example, here, this is how I understand an organization developing along its role towards becoming data-driven. And in Malta, what we see very often is organizations are hovering between data denial, we were speaking with John Paul just before this webinar. I've been doing it like this for the last 20 years, or I don't need it. I'm doing it well enough as is. There's the data indifference. So we don't even have an interest, to be honest, if we're in that stage. And then we become data aware. There's an awareness that, listen, things can be done better. That data, collecting data and monitoring it is important, but we don't yet know the actual benefit that it can bring us. This is a very pivotal moment in an organization's life cycle towards being data-driven, because at that point, and I believe that is where BOV was, when they decided, listen, all right, let's invest in this thing, is we've got all of this data, and to be fair, BOV is probably sitting on one of the largest data sets in Malta, and we need to do something positive with it. And the first positive thing is get informed. So use your data to inform your employees, your decision makers, so that we start truly articulating and understanding what it is that's going on in our business, with our customers, with our products, with our overall performance. And the ultimate goal in an organization is being data-driven. So no single decision is taken without first being informed by data. And the beauty of developing along this route is that you gain certain essential wisdom that make you just win. You have to analyze the data, understand what it's telling you, do exactly what the data is telling you to do, and you win. So this is something that makes me really, really excited about what I do and the value that I deliver to organizations like BOV. And on your way towards being a data-driven organization, there are a series of types of data insights or data analytics that one needs to do. And I like to segment them into these 4 pillars, which is the very first, and it's probably low investment, but already a very big aha moment for many organizations, is simply describing what happened, the descriptive analytics. So creating performance reporting, understanding your product, understanding your customers, seeing where your profits are coming from, just describing the what. And then the next step, which probably requires a little more thought, a little more analysis, and this is where, for example, tools like R or Python start coming in, is why? Why did it happen? The diagnostic part. So, okay, I understand that, for example, our profits changed in this way. But why? What was the reason for that? And what went right? What went wrong along that journey? And that's very important, understanding the why, because it can then inform your position going forward. Which is why, and then the next step would be forecasting, so the prediction. Once you've understood, okay, what happened in the past, you've learned from what has happened and why it's happened in that way. Could you perhaps forecast on what might happen in the future based on your learnings before? And this is where we start pulling in multiple data sets. So you're not only studying one particular piece of the pie, so for example, profit, but then you start bringing in other data sets, such as customer, or you bring in a product, so that you start cubing the information you've got to be able to forecast what could possibly happen in the future. And then for me, the most exciting bit is the prescriptive part, the designing it. So if you understand the what, the why, and you can forecast, why not design your own future? And of course, when you want to design your future, you want to design a successful one. Going back, the truth is, and then doing what it tells you to do. Your chance. And this is the excitement of what I do. And I want to walk you through some use cases and examples of how a combination of these types of data insights have enabled BOV in the last year or so. So here's an example of the what. So this is a dashboard. I'm using Power BI here. Behind it, there are a series of Python and R codes that my team have worked on. And this describes, in one picture, the what when it comes to home loans. So we try to make them a bit visual. Now, I apologize, I had to put some blue boxes on confidential information. I know that we're still about to announce our financial report for 2022. So here we're looking at the customer angle, which is the panel on the left. We're also looking at the operations, which is in the middle. And there's the quality of it. So we're using colors, we're using volume, we're using shapes, so that whilst, yes, we do include the numbers for those people who like to read numbers, what we learn is that some people like to read numbers and some people are more visual. They want to see a picture, they want to see an infographic. So we try to provide a mix of two. And then in the bottom, we look at revenues and the cost, because that is a very big important piece. For example, how much does it cost you to serve your current customer base on home loans versus acquiring new business? What is the mix? And how has it changed? How has it changed from last year to this year? Is it important, that difference? Of course it is. Because very often that has a psychological impact. If, for example, lately it's becoming more difficult to onboard customers, especially with all the new regulations that are being placed within the banking sphere, then you might need to take certain decisions on how you would like to set up your organizational team vis-a-vis onboarding and serving your current base. And something that is very much at heart for myself and this bank is the customer satisfaction. I don't think we're there yet in where we want to be. But at the moment, we are really placing a lot of focus on understanding where we are today and why it's there. So on the right, we have a panel dedicated to customer satisfaction. And this is important. So this is the what. And this is the first step. This is the first low-hanging fruit. So whereas before, perhaps we had a lot of Excel sheets, spread around the organization and different views of what performance looks like. Now we have a cohesive approach, and it looks pretty. Beyond that, so going to the next step is why. So here again, I'm trying to stick on the home loan. So here's a snip of the kind of data that informs our market share on home loans. Now, according to CBM, I will have the Central Bank of Malta, we have about 40% of all the home loan balances in Malta. But it's very important to understand, okay, great. I mean, that's a great share, but how do we get there? Like if we had to compare how the drawdowns are comparing with paying off of home loans, how is that looking? And why are we still commanding 40%? How have we grown over the last few years? And this offers, I mean, this is just a few, so forgive me, I can't share a lot of the confidentiality within the data, but it allows a perspective of understanding why we have been so successful in commanding a certain particular share of the market. And we relate it to, in this case, the rate of inflow versus outflow to explain our current position. But then it takes us to the fun bit, okay? So there's the forecasting and the prescribing part, and I put them together for a particular reason. Because once you understand what a possible outlook could be, then you could say, okay, hold on a second, I want to change that outlook. So here what we're looking at is we got the number of deeds by households. I mean, this is NSO public data. And we said, if we continue with our current operation, our current trends, we're going to have this outcome, but maybe we can do better, you know? And what do we need to do better? So if, for example, and these are, forgive me, but these are not dummy numbers, but they show my point. If the gray line is where we expect to land with our current operation, but we would like to be up here on the purple line, then what would that mean in the amount of people that we have employed in the branches? Do we need to make some changes in the teams or the focus or the marketing campaigns? And the answer would be yes, because if you want to design a different outcome, you need to behave in a different way. And the data can measure specifically what that difference needs to be. So for example, in terms of number of deeds closed within a certain period. And if you know how long it takes or how much effort or how many resources or how many people you need in your team, then you clearly know how many people you need to recruit by the end of that particular time period. So say 2024, for example. And this is how we're helping BOV design a future for itself that it desires, rather than allowing the future to kind of dictate itself to BOV. And it's important because, and then when you plan for the future, you're also planning accordingly to be able to serve your customers according to that future scenario without any surprises. So these, I'm just reminding you of the different steps that we went through. But I will explore now real use cases that you might have seen in the market. So I'm going to talk a little bit about targeted marketing. Now here, this is a home loan advert that we had used in 2021. And it's a bit of a catch-all, so it's about home loans in general. We're looking at an image of a family with a dog. They look like they're in a garden. And it's a lovely, attractive image, which worked because the marketing was very beautiful. But when I joined BOV, we said, let's see if we can look at this a little bit more in detail. Let's see if we can make it more targeted. And we did a little bit of an analysis of like the age distribution, maybe the distribution between single and joined homeowners, the split between females and males, and then we superimposed the males and the females over these separate age buckets. And something that we learned is that when we understand a particular cohort, and in particular first-time buyers, that was our focus of this analysis, the artwork could be a bit more pertinent to the target market. And when you're more targeted in your marketing, your return on investment increases. So this is how our imagery changed. So something we learned is that if we went specifically for first-time buyers are younger, and specifically how young, and that was this age group, the kind of property that they owned, they didn't have properties that would have gardens, for example. It's more like an apartment, maybe 2-bedroom, something, a bit more modest. And we learned as well the demographics. So here we're only focusing on the joined purchasers, but they were equally male and female and same-sex customers. So it was important to bring out the true demographic that is really actual within the market, so that it delivers home better. And we really did see an improvement in the applications and the relevance it had for the market. The results, due to confidentiality, I can't share, but we will be seeing that these results probably in future when we communicate the financial report. Another really fun case study is propensity. Now, propensity is, in a nutshell, the probability of a customer saying yes to a sale. And through some extensive analytics, and here, to be fair, we needed to rope in external resources to be able to do the coding required behind this analysis. We had a whole pool of people, and that's the group on top, that's your entire BOV cohort. And then through propensity scoring and probability scoring, you understand those groups of customers that have a high possibility to respond positively to a sale for a particular product, a medium and a low. And when then you understand that, you can focus your efforts rather than the entire cohort of the BOV base, only specifically on the high propensity customers. And when you're more focused, you can deliver better effectiveness in that sale activity. Okay, and I'm going to show you a little bit of what that looked like. So for example, this was a pilot that we ran for personal lending products. So personal lending, we're talking about credit cards, personal loans, things of that sort. And we generated in the pilot 129 qualified leads. We call them qualified because they went through this propensity coding engine, of which 29 said, yes, you know what, I want to walk into your branch and meet you to learn more about what you have to say. So what it was over there was, okay, Mrs. Borge, I would like to speak to you because we value your custom with BOV, you're a very valued customer, and we can tell that we have a suite of products related to, for example, credit cards, which would really suit your purpose because they serve, for example, spikes in spending come Christmas, maybe, you've got your insurance coming up. And the wording used in that particular conversation is actually described through the propensity. Because the propensity doesn't only say, listen, these guys are high, but it actually gives you a reason why. So perhaps this person is currently experiencing a sudden increase in their spend. Or this person is the person who usually handles within the household the costs related to Christmas presents or the costs related to insurance. And this is why, and then the sale conversation is so successful. And actually, the person is more willing to come and have a meeting with you. Out of those 29 meetings, we had 12 successful sales. So that's a 9% conversion rate. And in the world of banking, that is phenomenal. That is really great success rate, a conversion rate, and something we're truly, truly proud of. Over and above that, but, and this is where the real cherry lands on the cake, is 3 of those sales, those customers, recommended us to either their mother or their partner, and we generated another 3 sales. So that 9% actually went up to 12%, which for us is a huge success. And it shows as well that the customer is appreciating that custom. Not only that, but our employees are just so ecstatic about the positive, first of all, the results that they're generating from their efforts, the positive interaction with the customers, that they're telling us now, give me more, So whereas before we were pleading to do a pilot, now, we have everyone knocking at our doors to say, listen, let's see how we can work more together. So and this is the content of the presentation I wanted to share with you today, where, to be fair, in reality, the ability to offer insight to an organization is literally low-hanging fruit. So yes, you do a lot of analysis. Yes, you work on the codes, but the actual result is very simple. And that's what drives my passion, to be fair, in data analytics within organizations. So thank you for listening, and I hope to answer some questions.
Thanks, Lara. Thank you very much for a very interesting presentation on the subject. Thank you very much. Gozo Business Chamber and your direct, Gozo, firmly believe in a more digital world. The digital sector means new possibilities for careers in this sector. More sustainable businesses and organizations can also result when adopting data analytics, as was clearly shown by our 2 speakers. Again, thank you very much. Now we open the floor for Q&A session and also on our media. So I'll have to see if we have any questions. Yes, in fact, we have one. The first one is for Dr. Kauki. So Dr. Kauki, you mentioned the cleaning of data. What does this exactly mean? And could you give us practical examples, please?
Okay, so cleaning, I'll give you a very simple example. You're required to write yes or no in the data set, and people write yes with a double E or no with 3 O's, you know, something like that. So you will need to actually recognize that there are errors and then clean them. So you say any case with a double E or a double O becomes the standard. This is very important because otherwise your data will not, you know, the computer will not recognize what you've written. I've given you a very simple example. I'll give you one other example, which would have been problematic during COVID. Some computers have their dates in UK format, others have an American format. So you'll have date month year as opposed to month date year. Okay, so imagine, I'll give you a hypothetical example. Imagine there is 04/05/2021. Did the patient get infected on the 4th of May or the 5th of April? What if that means that you have to decide, you know, it's going to be a month long difference, you know, how are you going to make your decisions? So that's where data cleaning comes in. You need to make sure it's standardized and correct.
Thank you, Dr. Kauki. So we have a question from Mr. Elvaji. I'm a small business in the retail sector. How can I use data analytics in a practical manner to both promote my business and increase efficiency?
I love that question. So the very first step is understanding who your customers are. Now, in the retail sector, you have the very fortunate position of every time a customer interacts with your product, they're either walking into your brick and mortar store or purchasing online. And in that moment, you're creating an interaction where you can collect either information about the customer. So think about demographics, age, sex, interests, and the sort. Or else you can actually collect information about what it is that you're selling. So on a very simple scale, if most of your customers are choosing the color black or they're choosing, for example, trousers, then of course you must include that in the content of what you are doing when it comes to marketing or any kind of communications, because you would relate better with that customer. If you understand, for example, the demographic, so are they 20-year-olds, are they 50-year-olds, the channels upon which you would communicate your demographic will be very, very different. Even the language you would use, and even the imagery that you would use would have to be adapted to your particular customer cohort. Now, okay, it's not always so easy to collect data on customers, especially if the customer needs to give it to you of their own accord. And over there, what you do need to do is create a motivation for the customer to do that. Either there needs to be a reward or there needs to be some sort of benefit. They can get, for example, an additional discount, or they can get free delivery or whatnot if they participate in answering a few simple questions. Allowing yourself the opportunity to truly understand your customer and then speaking in their language on the platforms that they use will be a paradigm shift for a retail company.
Thank you very much, Lara. So, got a question from Mr. Tonio Bezzina to Dr. Kauki. So when it comes to AI web services like, for example, AWS, Microsoft Azure, Google Cloud Service, etc., what are the considerations for data ownership and data privacy?
That is an excellent question. So we only are considering using these software because they are certified as GDPR compliant. Additionally, we're taking extra steps are being taken to make sure that they are so, you know, that there is no retainment of data. For example, the Maltese government system tends to use Microsoft Teams and Microsoft systems for its security. So therefore, that makes it sort of within the same framework. in the case of Azure, for example. We absolutely give this the top priority. We would never share personal private information on other servers or systems.
Thank you very much, Dr. Kauki. So that's all the questions we have. So now, last but not least, I would now like to invite Daniel Borch, Chief Executive Officer here at Gozo Business Chamber, to make his concluding remarks. Daniel.
Thank you, Jesmond, and thanks to all our speakers for their in-depth presentations and insights. John-Paul Kauki from Queen Mary and also Lara Selvaggi from Bank of Valletta. Both Queen Mary, University of London, the campus here in Gozo, and Bank of Valletta are important partners for us here on the island. As regards Queen Mary, it is important for us as a chamber to see not only a foreign investment, but a research institution operating in Gozo and operating successfully. And Bank of Valletta for us has been a long-time partner. So it's interesting to come to know about these developments in the business world. And obviously, we hope that we continue sharing in this in-depth knowledge also in the future. So thanks, John-Paul, and thanks, Lara. One of the 6 priorities of the von der Leyen Commission, because we did this webinar in collaboration with Europe Direct Gozo, was a Europe fit for the digital age. This priority shows the importance that the European Commission is putting on digitalization. Though the legislative cycle of the European Commission is well into its second half, important pieces of legislation in the digital world have been enacted and implemented. These include, for example, the Digital Services Act, the Digital Markets Act, and also the directive on a high common level of cybersecurity. And cybersecurity is also a subject which is very much gaining in importance. And I admit that as a chamber, we need to explore more on it in the future. For us, as highlighted also by our President Joseph Borch, it is an annual event. We pick on one particular area of digitalization, and today we chose this aspect of data analytics. I'm sure this webinar was beneficial both to students, organizations, and also the wider business community. For students, I believe, though, this is especially important. We have been picking up on specialized areas every year. In January 2023, the Commission put forward a communication on harnessing talent in Europe's regions, promoting reskilling, upskilling, and to support the resilience and competitiveness of the EU. And I think one of the benefits that came out of the COVID pandemic is that as a European Union, it is more important that we need to rely also on our own resources and invest in human resources. The European Commission cannot reach its targets in the area of digitalization if it does not have the required human resources to achieve its aims. And the scope of this webinar is to show the opportunities in this sector, while also showing to organizations the benefits that come up with digitalization. Thank you very much.
Thanks, Daniel. As Daniel said, I sincerely hope that this webinar has proven useful to ensure that businesses and organizations in general can be more effective, while also providing exposure to new career opportunities in this sector. Finally, a special note of thanks also goes to Richard, who was the technical coordinator during this webinar, and also staff here at the Chamber, Joanne and Gianluca, for their assistance. Thank you all and have a good day.